Dr. Richard Saul is a member of the American Academy of Pediatrics, also an American Academy of Neurology, and he's a doctor, and he's written a brand new book, and it's called ADHD Does Not Exist, The Truth About Attention Deficit and Hyperactivity Disorder. Dr. Richard Saul, welcome to KTRS here in St. Louis.
Thank you, McGraw. How are you?
All right. If ADHD doesn't exist, what is going on? Because mothers and fathers will tell you that their kids have something. If it's not ADHD, what is it?
Well, that's the point. I think ADHD exists as a group of symptoms, not as a disease. And I'm trying to get away from the fact that it's ADHD, therefore you take a stimulant. I think it's ADHD, and you have to do a checklist to find out what various things could cause it. Are they anemic, and do they just need iron? That would do it. Are they just bored? Are they overstimulated with their electronic toys? Are they depressed? Do they have thyroid problems? Are they bipolar? There's a lot of things that all have the same exact symptoms. So I'm trying to get away from this reflex of you just have to take a stimulant. And McGraw, it's a disaster. There's been 1 million new prescriptions this last year for stimulants. 1 million. And 1 out of 9 school-aged children is taking a stimulant.
Let me ask you this, doctor. I anecdotally, I'm a talk show host, not a doctor, but I agree with you to a certain extent that it makes sense that some children are being misdiagnosed as having ADHD and they have all these other things. But does that still mean that nobody has ADHD, and maybe there are some people who are ADHD and there are other kids who are being misdiagnosed as ADHD?
That's a good question. One of the I've got all these chapters in the middle of the book about what it could be, and one of them is called a neurochemical distractible impulsive child, and that's the one who, some of whom could use a stimulant. I've looked back over 5,000 patients, the last 5,000, and 5% of them needed a stimulant, 5% out of 5,000. The rest of them didn't. So does that mean they don't have ADHD? Sure they have it, but it's not ADHD, the disease. It's ADHD, the symptoms. So they're impulsive, they're distractible for the reasons that I mentioned to you before.
The book is called ADHD Does Not Exist, Dr. Richard Saul. Doctor, you're saying this is more of a doctor's fault than a parent's fault.
Well, whoever, you've got drug companies advertising, you've got teachers saying, I can't teach this kid because he's too creative and can't sit still. Instead of trying to work out a program, and a lot of the schools have 30 or more children in a class, it's difficult for the teachers. So she says, go to the doctor, see if it is ADHD. But the doctors aren't really seeing if it is. They're just saying, well, okay, here's a checklist, and we'll go through that. I don't know if that's the doctor's fault because they don't really have the hour and a half or 2 hours that it takes to do this kind of evaluation. But the parents do, and the other third of my book is in how do you do the evaluation. So they can do it themselves, and they don't have to buy the book. They can get it in the library and download the various questionnaires that are necessary to check for, besides ADHD questionnaires, because that's the one that everybody focuses on, questionnaires for depression, for bipolar, for anxiety, for post-traumatic stress syndrome. They're simple questionnaires, and they'll be able to get a pretty good idea on their own and then go to the doctor and say, hey, look, we did these questionnaires, and this is what we've come up with. The doctor, on the other hand, ought to be looking at thyroid and whether they're anemic and the various medical conditions that can mimic this. It doesn't take that long to do that part. So it's a combination.
It seems kind of funny,
everybody.
though, that you would treat ADHD with a stimulant. That doesn't make sense to me.
Well, in the cases where they need a stimulant, it's because they don't have enough stimulant in their nervous system. And that's a test that they do at Mayo Clinic. That's a test that they do at this Quest Laboratories, which they have in St. Louis. And they can tell you if there's not enough stimulant, then yeah, that's the right thing to do. If there is, then it's not the right thing to do.
What did kids get diagnosed with in the 1980s before ADHD, quote unquote, existed?
Well, I don't know about the 80s, but before that, they would sit in a dunce chair, and of course they couldn't do that. Then they started moving them out of the room because they were so disruptive. They would sit in the hall and be disruptive. And I'm trying to think back to the 80s.
But I mean,
when I obviously didn't have this number.
Right. I mean, it seems like, Doctor, there is a much larger number today than back in the early 80s when I went to school. You never heard of ADHD, and there were a couple of problem kids, but it doesn't seem like the sheer number there are today.
Right, and it's all in this advertising and promotion, and it's almost like a quick fix. Take your kid; they've got ADHD. Well, maybe not. Maybe it's something different, and I don't think diet has a lot to do with it, unless they just have a horrible diet. But there is a genetic component, and that once somebody does have the true findings of ADHD, there's a 1 in 4 chance they'll pass that on. So there is a gene. Actually, we know the gene, but the problem is on that gene is also bipolar disorder, depression, and autism. So the question is, are all those things with ADHD mixed together, and are we just picking out one of them, or are we maybe should be looking into all of those things if that's the symptoms? But the genetics has a lot to do with it, of why it's mushrooming in number.
Doctor, wish we had more time. That's why you wrote the book, ADHD Does Not Exist, The Truth About Attention Deficit and Hyperactivity Disorder. Dr. Richard Saul. Doctor, thank you for your time this morning.
McGraw, thank you.
You got it. 7:58 here, traffic and